Darling.
Thank you, Madam Deputy Speaker. And Torbay Hospital is very much a family affair for my family anyway. My wife has worked there for more years than she would let me admit in this chamber, and my son is now a registrar at Torbay Hospital. So I thought I knew the hospital quite well until I got elected, and then the chief executive of Torbay NHS Trust opened a Pandora's box of pain and challenges that the hospital faces. And I was really angry at how the previous Conservative government failed to invest in the desperate needs of our NHS, both in Torbay and across the country. Yeah. So it was with hope in my heart that I came to this chamber in July, hoping that over the next few months, Labour would be part of the solution. And so it is extremely sad and disappointing that Torbay feels as if it has been kicked into the long grass. We know that this means that there will be a failure in serving our communities. We are expecting outstanding staff to deliver services in poor conditions. And Torbay also is one of the most deprived communities in the southwest, so we're letting down some of the most poorest in our communities. I just wanted to share some of the contents of this Pandora's box with the Chamber, if I may, Madam Deputy Speaker. When you visit the hospital, you have a viscera of hope that there is scaffolding around the main tower, but this is actually to stop the pieces of the tower falling on NHS workers and visitors to the hospital rather than repairs being underway. Also, there are almost 700 sewage leaks across the hospital. Many of these are actually impacting on clinical areas. Whole wards have been shut down and had to have deep cleaned due to these sewage leaks within Torbay Hospital. Only 6% of the hospital is of A1 standard. In terms of seeing how poor it is, that is extremely stark. There are immediate pressures that we face in Torbay. We have cuts to coronary care out of our services that could mean that those in Torbay and South Devon nearby constituencies could be put at risk of tissue death because there is not fast enough interventions for coronary conditions. We are looking at, with pleasure.
I thank my honourable friend for giving way, and being in the neighbouring constituency to himself, it is my constituents in the largely rural area of South Devon that are going to be severely threatened by this move of coronary care, this closure of out-of-hours coronary care in Torbay, because somebody decided it would be a good idea to merge it with coronary care in Exeter, meaning an increase of potentially up to 45 minutes in an ambulance for constituents from the south of my constituency to get to hospital. It's clearly going to put people in critical danger, and I'm sure my honourable friend would agree with me that we desperately need the ICB to reconsider this poorly thought-out decision.
Thank you, Madam Deputy Speaker, and I strongly agree with my colleague from South Devon that this is a wrong-headed approach and needs urgent review. Also, in Paynton, there are threats to the long-term delivery of ambulance services from that town, so added delays in supporting communities. But perhaps the biggest threat is a financial threat. Down in Plymouth, we've seen £60 million of cuts to budgets being announced in the last few days of our health services. In Torbay, the hospital came out and admitted that they are looking at £40 million of cuts to services in our NHS at Torbay. With £100 million worth of cuts across that part of South Devon, where has the money gone? Can the Minister please tell us, with these pressures on our services in South Devon, where has that money gone? How can he intervene and support our services, because our hospitals are crumbling in Torbay? Yeah.